It's 8 o'clock, and good evening, everybody, and welcome to today's episode of Marvelous Medicine, which is about the importance, or should I say, relevance of milestones in a medical surgical career. The speaker is Dr. Karthikeyan Gomathinayagam. He's a senior consultant plastic surgeon in Chennai, and he was previously professor of plastic surgery in the Tamil Nadu Medical Service. Dr. Karthikeyan did his MBBS from Madras Medical College, MS General Surgery from Madurai Medical College, and MCH Plastic Surgery from Kilpauk Medical College. He has several publications to his credit and has co-authored many textbooks. He's a much sought after speaker. His areas of interest include hand surgery, microsurgery, and brachial plexus injuries. He has embraced digital surgical education in a big way, and he creates and shares at least one video every single week without fail. His life and career in medicine and plastic surgery will give us an insight into how we should look at milestones. Thank you, Dr. Karthikeyan, for readily agreeing to do this talk. Moderating the session will be senior plastic surgeon Dr. Sridhar. Dr. Sridhar did his MBBS and MS General Surgery from Kasturba Medical College and MCH from Stanley. His special interests include craniofacial, aesthetic, and plastic surgery. He has innovated several surgical procedures. He is part of the Kanchi Kamaguti Shankara Medical Trust. He's obviously delivered many invited lectures and orations and has several publications in various journals. His book, Forgotten Freedom Fighters, The Unsung Heroes of Tamil Nadu, was one of his non-medical works. Joining us as a moderator is Dr. Nirmala Subramanian, one of Chennai's senior most plastic surgeons and a teacher and mentor to Dr. Karthikeyan. Her career will reflects the evolution of plastic surgery from basic skin grafting to reconstructive to aesthetic. Dr. Nirmala has been a teacher and a mentor to generations of plastic surgeons. Other than achieving her own milestones, she has assisted many other surgeons to achieve milestones in their life, and so we look forward to your perspective, madam. Thank you so much for agreeing to be a moderator at such short notice. And last but not the least, we have Dr. Bharati Raj Sridhar, who will bring a young surgeon's perspective to this whole discussion. She's a consultant cosmetic and plastic surgeon at Dr. Mehta's Hospital, and she's also the founder and director of Plastic and Cosmetic Surgery Clinic. She did her MBBS from Ramchandra Medical College, MS General Surgery from MS Ramaya, and MCH Plastic Surgery from Madras Medical College. Despite having a lot of personal commitments, she has agreed to be part of this session. Thank you so much, Bharati. Over to you, Dr. Karthikeyan.
Yeah, can I start off then? Yeah, shall I share my... Yes. Good evening, everyone. It's always a pleasure to speak on Facebook, especially from Marvelous Medicine. And we were just talking about it. Dr. Radhakrishna and me were talking about this and how it started during the COVID. There I used to take 1 hour classes almost 2 or 3 times a week. And it has come a long way. And Marvelous Medicine is really, according to the name, it's doing marvelous work. And it's doubly a pleasure for me today, where I'm speaking in front of my mentor, Dr. Nirmala Subramanian and Dr. K. Sridhar. I mean, I'll talk about them in the course of the lecture or talk. And amazing people. So now, Vanakkam and greetings to everyone. Every single surgeon here, every single doctor here has got, when they start off, they have dreams in their heart, fire in their eyes. They all want to achieve. They want to achieve something, they want to excel at something, and they want to make a difference. Whatever field of surgery they are in, be it gastro or be it plastic or be it vascular, whatever, they want to make a difference. That is what they want. And this fire in their eyes needs to be met. And it depends on the mentors. We've got wonderful mentors in this group. It depends on the mentors to show them the way. Why do you need to show them the way? For instance, if you're going from Chennai to Madurai by road, you have to first cross Tambaram. Then you have to cross Chengalpattu, then Madurantakam, then Dindivaram. So these are milestones to tell you that you are on the right track and also to help you gauge how far you have come and how much more distance is there. So this sort of roadmap is something we need to create for them. And when I say roadmap, I'm talking about these milestones, like Tambaram, Pintivanam, all these milestones we need to tell them so that the youngsters are able to go into the field and achieve, not become just good surgeons, but these roadmaps are very important to become great surgeons. They can become good surgeons, okay. Now, what is the difference between a good surgeon and a great surgeon? Here I put up a picture of a good surgeon and a picture of a great surgeon. Can you make out the difference? There is no difference. It is not seen on the outside. The difference between a good surgeon and a great surgeon are many, but not in the appearance. The first thing is, a good surgeon knows when to operate. When we get an injury like this is obviously a cut of the flexor tendons. So the good surgeon knows when to operate. He will get the case ready and operate. But a great surgeon knows when not to operate. If this patient is an uncontrolled diabetic with a coronary artery disease, it is better to do a skin suturing, get the factors under control, and then do the surgery. That is what differentiates a good surgeon from a great surgeon. A good surgeon finishes the case. For instance, this is an electrical burn sustained on the left arm over the posterior aspect. The radial nerve is completely charred. So a good surgeon will reconstruct it beautifully. But a great surgeon will take responsibility for the complete journey before, during, and after the flak cover has been given, after all the wounds have healed. He takes care of the patient, takes care of the physiotherapy, takes care of the rehabilitation, the nerve surgery, the tendon transfers, everything. That is what differentiates a good surgeon from a great surgeon. And the good surgeon masters the techniques, whereas the great surgeon adapts and innovates. Now, this you can make out obviously you can make out the swelling, multiple metacarpal fracture dislocations. So this has been done. The good surgeon will be able to do it, but you need to adapt. You would note that there has been a fasciotomy has been done. So this is an adaptation which is not described in a textbook. It doesn't say that you do a fasciotomy for a multiple metacarpal fractures. So this is what needs to be done. The good surgeon is respected for outcomes, whereas the great surgeon is respected for how he makes patients and members of his team feel. There was a time when a great surgeon was supposed to be a person who would throw instruments around and throw tantrums in the theater. This is what a great surgeon used to be, but it is no longer like that. A great surgeon will be respected for how he makes his team members feel. A good surgeon builds careers, his family. That's good. That is a very responsible person. Whether it is a male or a female, it is a very good characteristic. But there is a difference. A great surgeon will build people. He brings them up. He creates a team. He builds a team. He encourages them and he makes them grow along with him. That is another difference between a good surgeon and a great surgeon. A good surgeon will always have satisfaction and success. A total amputation like this, we put it back and the good surgeon is very satisfied. But a great surgeon, he will find meaning even in failure. This replantation which has failed. He understands, he probes, he tries to understand why it has failed so that the next time this problem would not occur. So that is a difference between a good surgeon and a great surgeon. So thinking about all this made me thinking about how can we describe the milestones for a great surgical career? Now, that is a very interesting thing. So then I thought, okay, let me think or retrospect about my milestones so that we can try to derive at what should have been the milestones for a great surgical career. And so crossing milestones. My milestones were quite normal. I crawled at the correct age and I started walking at the right age also. So as far as that was concerned, I was perfect. And then I took my first steps into plastic surgery with the same hunger that all of us have, all the young surgeons in this group have, all the mentors in this group had, to become skilled, to become known, and to become good. So that's what we wanted. And my first milestone was in Kilpauk Medical College when I did my MCH plastic surgery. This lady, who was my first mentor, I learned surgery, plastic surgery, the ABC of plastic surgery from her. And I also learned the finesse in plastic surgery, in surgery. So I thought, okay, my doing my MCH and getting my MCH degree was a milestone. I was very much indebted to her. But what happened? Things changed. She was the first person to have performed the successful microvascular anastomosis for the first ever successful replant of thumb and hand in the country, way back in 1981. Then she presented her clamps to me just about a couple of years ago with her handwritten note about these being the clamps with which she performed the first replant. I said, my getting the MCH degree was not a milestone. This, I felt, was a milestone. And then, after my MCH, I went to work as assistant professor in Stanley Hospital, where Dr. G. Balakrishnan was the guiding force there. He taught us work culture. And with work culture, he taught us to speak with honesty, think with sincerity, and act with integrity. Okay, so I have learned all this from him. I've tried to learn all this from him. So, is it a milestone again? Not yet. Again, a few years later, down the line, when a book was being created, Crafting a Legacy, The Incredible Lives of Asian Pacific Hand Surgery Pioneers, Dr. Balakrishnan chose me to write the chapter on him. And that, I felt, was a milestone that had been reached. So now, my idea of milestones was changing slowly. And then, when I started working, I used to do a lot of replantation. And they failed. I had failures. Not one, not two, not three. I had a string of failures. And this led me to Dr. Balakrishnan suggested that I go to Ganga Hospital with Dr. S. Rajasapapati to learn a little more about replantation. And this was in August 2003. I went there for 3 weeks. And what happened was, after I came back, just note the date. On September 6, 2003, a patient presented, a young girl, 16-year-old girl, presented with the amputation of the left hand. And I did the replantation for this. And as I finished this surgery, the next patient presented with an amputation. A 40-year-old lorry driver presented with an amputation of the left hand again. So, and to my success, to my surprise, both these replants survived on a single day. And this, perhaps, this was a milestone. I don't know. So it was, I used to think it was a milestone. But now with my changing paradigms, I was wondering whether it was a milestone, because a few years down the line, again, there was a situation where I did 2 replantation in a day. The first one was a success. The second one was a failure. But something very surprising happened. The patient who had a success went away without even looking back at us. Whereas the patient who had a failure, he was so happy that we had done something for him. Now that again made me think, this patient is now trusting me. I have failed him. I have not been able to give back his hand. Was this another milestone? Now this got me very confused. It always gets confusing when the appearance is not what it is. Unlike this, you can see the shape of the head is the same. But please don't be deceived by appearances. It is what is inside that is important. For instance, in this picture, what is inside this man's head is how to inspire and motivate more people. Whereas what is in this man's head is, when are they going to serve dinner? So my next dream of microsurgery came up. We were doing microsurgery at Stanley Hospital. But this man, Professor Mukunda Reddy, who was conducting a rapid free flaps harvest, was sort of changing the direction of microsurgery and making it easier for everyone. So I learned it like Ekalavya learned from Dronacharya. And I started doing. This is a hand, Folkman's ischemic contracture in a young man, a lawyer. Who came with this problem with absolutely no flexion in the fingers. So I did a functional gracilis muscle transfer. And this was the result. He is able to completely move his fingers and use this hand for work. Was it another milestone reached? Every time we see something like this, we say, I have achieved it. Another milestone. I began questioning this. And then when this patient, little boy, 11-year-old boy with an amputation of the thumb following electrical burns, I did a toe transfer. And he started using the hand for writing. And then, few years down the line, his mother came to me along with the son, who has now joined a pharmacy college. Perhaps that was a milestone achieved. And then I started my YouTube channel in November 2019, GK Hand Surgery, and now it has been running for 6 years continuously. Every Sunday at 6 a.m. I upload a video. I made a commitment that I would upload a video. And every Wednesday at 6 a.m. I upload a short video to help the younger generation. And what did I get out of this channel? After starting this YouTube channel, what was the difference that I felt? Total of 608 videos to date. 51,400 subscribers to date. 4.3 million views. What else? I was hoping actually that I would buy a Bugatti. But with the money I got, I could buy half of a second-hand Maruti car. Anyway, that is different. But I got many other things. Was this a milestone? I got many other things. It taught me discipline. Every Sunday, I have to release a video. It gave me confidence that I could do it. It taught me things that I did not know. When you take a class, you learn again. And it got me friends worldwide. And I was doing what I loved. Wasn't that a milestone? No, that was not a milestone because something happened along with that. I started getting letters like this, emails. I am an Australian plastic surgery trainee who just wanted to thank you for all your videos. Or, I am an orthopedic surgeon from Poland currently working with the European healthcare system. Thank you for your videos. This, I felt, was a milestone reached. Then I have been able to reach people who I will never see from places I may never see at all. So then, after my retiring from government service, this person always continued to inspire me. I never got the opportunity to work with him. But he was always with a mission, and always adapting and innovating. Dr. Sridhar. People have asked me, how can you be inspired by the person with whom you have not worked? I said, the sun is there long, far away. You don't have to go and sit with the sun to get the heat and get the warmth. Even so far, you can get the warmth. So this man, meeting this man, I felt was a milestone. No, it wasn't a milestone. What happened was he told me to come to SIMS, join there. He asked me. So when such a great person is asking me to come and join, inviting me, I felt that was a milestone reached. Now, these are different concepts of milestones. I'm telling you what I thought was a milestone and what I realized is actually a milestone. And the second person there, Dr. R. Krishnamurthy, with clarity of thought, planning perspectives, and fantastic idea of basic principles. Was working with him a milestone? No, not yet. So he clarified the brachial plexus. He used to make it so simple, break it down. And when I performed my brachial plexus surgery for this young man who doesn't have much movement in the right upper limb, and when he started moving the hand slowly and completely, I felt the milestone had been reached because what he had taught me, I was able to transfer to the patient. And then finally came conducting a state level conference, the TANPAPS 2024, which is the state conference of plastic surgeons of Tamil Nadu and Pondicherry. Was this a milestone? Was it a milestone? No. The milestone was getting my colleagues and students together to help me in conducting the conference. And not only that, each one of them was excelling in their own field. For instance, Dr. Selva Sitaraman, who is a hand transplant surgeon, he has done 3 hand transplants so far in Tamil Nadu, and he's secretary of the Association of Plastic Surgeons of India. Next, Dr. P. Jayakumar, who did the first hand transplantation in a government hospital in India. The third was Dr. R. Sridhar, who is a professor of plastic surgery and one of the most popular teachers of plastic surgery in the country, and Dr. Subhashini, who is an associate professor at Sri Ramachandra Medical College, and she is the head of the academics of the Indian Society for Surgery of the Hand. Seeing these people excelling was what I felt was a milestone that was reached. So my typical milestones, what I thought were my MCH specialty, my super specialty degree, starting microsurgery, YouTube success, all that. Are these milestones or just markers? These milestones tell the world where we are, but they don't tell us who we are. So there are 3 types of milestones. Resume milestones that you can put on your resume. My degree, my publications, my positions. The world celebrates these. The second is skill milestones. My first flap, my first replant, my complex reconstruction. Our fraternity will celebrate these. But third, most important are the silent milestones. There is no certificate for this. There is no applause that follows. These are the milestones that define you. Who are you? So and so. That's your name. But who are you actually? It is these silent milestones. Now, so I began to wonder what actually matters in a surgical career. So when a young resident asks, what should I do to become a great surgeon? There are many mentors here who talk about this. What should the young resident do to become a great? He's got a dream. He or she has got a dream. It is our duty to show them the way, to guide them, to make them achieve their dreams. So my dear resident, the most important thing is character. Complications will come, failures will come, sleepless nights will come. And in those moments, your character will be your only instrument. Not your microscope, not your sutures, not your degrees. Your character is going to carry you across. So you need to develop your character. And how do you develop your character? What are the milestones that you should achieve to develop your character? Let us see that. When you develop your character, you reach what is known as the surgical summit. That is the heaven of surgical career. The first milestone is the right to operate. Competence. Whoever it is, they must be competent. So they need to master anatomy, technique, and basics. That is, the knowledge must be there. They must master clinical and surgical skills. The skill aspect must be there. Thirdly, respect for the patient, tissue, time, and attitude must be there. So competence is the first step towards achieving the greatness in surgical career. But remember, this competence is only the entry ticket. It is not the destination. So if you have become competent, if you are able to do a replantation, if you are able to do a free flap, I'm talking about the plastic surgery aspects. It is an entry ticket, that's all. Now you have entered. You are in the race, you are in the journey. Now, we go a little forward to the second milestone, judgment. The wisdom to not operate. The day you learn to say no is the day you become a surgeon. Correct case selection. You should select the case correctly. You should know your limits. If you feel that you are not competent or you do not have enough experience, you can always say no and hand it over to someone who is much more competent. And we need to avoid unnecessary surgery. These are things that you use your judgment for. And it is sad to note that many surgeons never truly reach this milestone. So once you have reached this milestone, you can go over to the next milestone, which is consistency. You have started doing surgery. You have started doing wonderful work. Once you need to show reliability under pressure. It may not be your best day. It is not the surgery that you do on your best day that defines you. It is the surgery you do on your average day. You know, we all have our best days and our average days. It's the average day surgery that's going to define you. We must show stable outcomes across cases. I have done free gracilis muscle transfer for about 5 to 6 years. After 5 to 6 years, when I did the gracilis flap for one patient on a particular day, at the end of the surgery, I felt that I had learned how to do a gracilis muscle flap. That was very funny because I had been doing it for 6 years. On that day, I realized what I was doing and why I was doing every single step. So that is important, that realization. And you should be able to handle fatigue, emergencies, unpredictability. Patients will be unpredictable. The body of the patient will be unpredictable. The attenders will be unpredictable. At the same time, you should be dependable in all situations. Never let down your team. Never let down your team. And you will be dependable. Patients don't need brilliance. They need predictability. This doctor will look after me, whatever happens. That sort of trust is what the third milestone is all about. Now we'll go further into the fourth milestone. Grace in complications. It's actually the test of character. Complications are not interruptions. They are the curriculum. You will have complications. You should have complications. You should own up to your complication. I know a few senior surgeons who run away from patients who have had complications. No, they cannot become great surgeons. When you have a complications, own up. Patients will understand when you tell them that you have had a complication. They know you are a human being also. And honest communication with the patient is very important. And standing with the patient. Whatever happens, I'm going to do my best for you. That is what is important. The fourth step in becoming a great surgeon. This milestone silently builds trust and reputation, which is very important in your journey to becoming a great surgeon. Now we come to the fifth milestone, which is teaching. When you teach, you start multiplying yourself. A surgeon who operates alone ends with himself. He has acquired so much of skill, so much of knowledge. When he does not teach, it ends with him. This teaching should extend to training juniors and sharing knowledge. When you teach, your impact becomes exponential, as I just showed you. The sixth milestone, ethics. Now we come to ethics, the last but one milestone. Ethics is nothing but doing the right thing when no one is watching. Skill will earn income, but ethics earns respect. It may sound very old-fashioned, but however modern the age is, this will never go out of fashion. Ethics will earn respect for you. A transparent consent, whatever can happen, write it down. Avoiding overtreatment and patient-first decisions. So the patient will start trusting you. This defines your legacy more than your skill. And the final milestone, the most important I feel, is after you, this is one thing. All along, we talked about milestones that you can develop. The seventh milestone comes automatically. Automatically, when you follow all the 6 milestones that I spoke to you about. Legacy. Becoming a reference point. This person does it like that. So everybody, it's good to do it like that. He does it like that. Let us do it like that. She does it like that. That is the way it should be done. At some point, people stop asking what you do. They start asking what you think because they want to emulate you. So that is when you have become a legacy. Mentorship, influence on private practice patterns, and inspiring the next generation. This is perhaps the most important milestone that a surgeon, great surgeon, has to achieve, will achieve, if he has followed all the other milestones, has come through that road. Because only then you are no longer a surgeon, you become a standard. And then you achieve what is known as the surgical summit. Now that must have been pretty tiring journey of the 7 milestones to achieving greatness in surgery. Even though we are tired, we are still happy because we have learned something. So what have we learned so far? What are the milestones in a surgical career? We spoke about degrees first. We spoke about skills, replantation, teaching, recognition. And then we realized that they are not the destination. We thought they were the destination. I should do this. Yes, you should do that. But that is not the end. That is not the destination. They are just markers on the path, on your path to achieving greatness. As we grow older, our decisions become clearer. Our ego becomes smaller. Our presence becomes stronger than our words. And our quest for learning must never cease. When I talk about quest for learning, I can give you 2 beautiful examples. The moderator we have with us, Dr. Nirmala Subramanian. I don't want to tell her age. I don't know, she might. 85-year-old lady. Wonderful surgeon. But you know what? She is now learning how to upload videos on YouTube. She wants to share her knowledge. She keeps learning. And that is amazing. And the other moderator we have here, Dr. Sridhar, he wants to learn about robotic surgery and artificial intelligence. And he has been called by at the national level to talk to engineers about what surgeons need in the form of AI and robotics. When all this happens, that is when we arrive at the surgical summit. Ultimately, for every surgeon, for everyone here, ultimately, the OP list becomes smaller. The OT list becomes negligible. And when the surgeon has stopped operating, A great surgeon. He has stopped operating. What remains is a career filled with many crossed milestones. The person has crossed many milestones. And then the ones that truly matter are not the ones you can count. I have done so many cases. No. I have done so many innovations. No. Not the ones you can display. I have got this award, that award. No, not that also. Not the ones that the world applauded. World applauded and cheered. No, even those were not the milestones. But the ones that are important were the ones that live on in the trust of the patients, in the hands of our students. We have developed the skill in them. We live through them in the respect of our peers and in the quiet knowledge that we did the right thing. The milestones that matter most are not what we achieved, but the ones that cannot be seen and what remains in others because of us. The knowledge that we have given, the skill that we have given, it could be the student, it could be the patient. That is what is going to remain as a legacy. And great surgeons, they just don't cross milestones. They achieve what is known as the surgical summit. Thank you.
Dr. Sridhar, sir.
Yeah, I think first I would like to congratulate Karthikeyan. Second, I would like to tell one more thing. Madam Nirmala Subramaniam is not only Karthikeyan's teacher, my teacher too. So you can understand now the gamut of people whom she has trained. I think I was the one first postgraduate under her. Even though she was an assistant professor at that time, Professor Venkateswamy's only qualified assistant was Dr. Nirmala Subramaniam. And she was the one who taught me how to do the first cleft palate, how to do the first cleft flap, how to do the cross finger flap. Therefore, I think I will leave it, Madam, to start off the discussion as a student of hers. And I was the one who assisted her for the first thumb replant. And the second one was my colleague, Dr. Sethu. Both of us were there for both the first and the secondary plants together with Madam. I think I'll leave it to Madam to start.
Madam, is it possible for you to turn on your camera, Nirmala ma'am? Madam, you got muted now. Dr. Nirmala, can you unmute yourself?
Yeah, I think she has unmuted. No, I think she has muted again. At least until Madam comes, I would like to tell you, I was there. Madam invited me to Kilpauk when Karthikeyan was the postgraduate student. And he presented as a thing. That day itself, I knew that this man is going to be a really great orator, great teacher. And that was the first time I heard him as a student, postgraduate student. He presented case in front of me. Madam has invited me to be there for his talk. That day itself, we knew that here is a man who is going to shine like a star later. So, what he said about milestone is, I think that is the first milestone. There itself, we knew what he is going to be. So, in other words, the destiny also something he has visualized from day one. So, he has marked his path. I am not the person who has marked my path, because I'm going to talk a similar one later, in which I'm going to tell that I have not marked my way. Like he has gone to via Tambaram, via Chengalpat. So his career also is like that. Mine was more influenced by others on me. That way, It is great. The message which I would like to tell, number one, is owning responsibility for your complication. I think that is the message which I would also like to give it to the younger ones. Because till today, he also knows one of my complication cases, which I did about 25 years back. She came to me last month to Sims Hospital for a small ulcer in her foot from all over from Calcutta. But what I delivered to her was a failed fibula. So, because we own our complication, we talk to them, we are transparent. I think that is one message which I feel that he has really conveyed it to others. Great, Karthikeyan. I think I would like others to who have been listening. Anything in chat box?
Nirmala ma'am, can we, if you can speak, we can find out whether we can hear you, ma'am, because we can't see you.
Madam?
I am sorry. I think I'm not able
Madam,
to.
we are hearing. I can hear you, ma'am.
You can hear me. Oh,
Yes, ma'am.
Yes, ma'am.
no. I am trying my level best, but it's somehow or other the mic doesn't seem to be working in my this thing.
Mic is
Okay.
working, madam. We can hear you well.
We
We
can
can
hear you.
Yes, ma'am.
You are able to hear me now?
Yeah, yes,
I'm
ma'am.
very happy. Okay. Now, Sridhar, I am very, very happy that I have been able to train some of the best surgeons, plastic surgeons in our Tamil Nadu. I don't know whether I can take the credit for it, no, but all of you have been extremely good. And definitely it pleases me to see all of you coming up like anything. Karthikeyan has done extremely well. And listening to his talk right now, I was really thrilled. Literally, I felt that somehow or other I should put out my hand straight away and I don't know what else I can tell you. I have had a wonderful time. I would say more than 40 years of plastic surgery, which I have done. And I really don't know what to say, Sridhar. I'm just overwhelmed with hearing Karthikeyan and his beautiful talk. Okay, I think you can take over now and continue.
Thank you,
Unless
madam.
you want me to say anything else specifically.
Yeah, madam, we'd like to come back to you in a little while about your thoughts on importance of milestones in one's career, because you have seen many more than most others in this meeting. So, how much importance to give them, and do you think sometimes we get carried away? So, we'd like to come back to you in a bit, madam, about your thoughts on the topic itself, which is the importance and relevance of milestones in surgical career. So before we go back to Dr. Sridhar, I'd like to call Dr. Bharati, who's the youngest of the lot here. And it so happened that everyone's a plastic surgeon. It was so. Your thoughts on Dr. Karthikeyan, and anything that you look at things a little differently, being from a different generation. We'd like to hear from you, Bharati.
Thank you, Vidya ma'am, for giving me this opportunity to share screen space with all the stalwarts in plastic surgery. Though I studied in MMC, I used to regularly attend GK sir's classes in Omanturar, not just an academic piece, but also gave us a lot of insight. And I think his GK sir's YouTube channel has been a life-changing experience for most of the young plastic surgeons. All crisp, short videos, detailing has helped us multiple times before we go for a procedure. We just quickly run through his videos, which has been very helpful. And regarding to the younger plastic surgeons, ma'am, as you asked, I think in addition to clinical competence and excellence, it's important to have visibility both in clinical forums as well as in the digital presence, which sir has paved way for us. And I think pretty much.
If you're able to hear me,
Yes, ma'am.
Yes, madam.
I
We're able
just
to hear.
want to say a few words. See, in way back in year 1969, we had gone to Boston. I joined at that time the Mass General Hospital, and my first mentor at that time was Dr. John Constable, who was a plastic surgeon. That impressed me. And when I came back and we settled down in Chennai, I decided that I will continue on with plastic surgery. And I joined Dr. CRS's unit, Dr. Sundarajan's unit, and did my MCH in plastic surgery. Would you believe I was not given a job in the Tamil Nadu medical services? The reason I really don't know, but subsequently, because of some pressure, I became an assistant professor there and continued. Then the next stage of mine was in Stanley, where I did and learn a lot about hand surgery. It was quite an extensive experience for me. And the highest point there was the reimplantation, which I did first time. This was the first reimplantation in the country, one can say in the whole of India. It was a thumb reimplant and followed by a hand. And that started off with the free flap transfers in varieties of ways. Then subsequently, I was transferred out, as happens in any of the government jobs. I was transferred to MMC, where I had to do a lot of maxillofacial injuries. From there, the next stage of mine was to Madurai, where I again, Madurai Medical College, there's sort of a what should I say, the type of cases which you get. Next, Keel Park Medical College, where I had to concentrate mostly on burns. So all through this, I have done hand surgery, facial surgery, facial-maxillary, burns, and then my introduction went to oculoplastic surgery, and which I joined at Shankar Netralaya, and I continued on. Even today, I prefer to do oculoplastic remarkably in a big way. This is, in short, about my whole lifetime, all the 40 years which I have spent in plastic surgery. I would say I'm a genuine full plastic surgeon because I have done all the specialties. I'm very happy about it. And right now, my concentration is purely on oculoplastic surgery. Now, all through these years, I have had very good support from the various plastic surgeons who were trainees, who later became very important in doing varieties of cases, like Sridhar, Balakrishnan, Karthikeyan, etc., etc. All these people have been doing extremely well, and I feel very, very happy, and I feel very proud that I have known all these people and have seen them coming up the ladder. Okay. With all that, I can only say I will bless everyone, because I think I am the oldest person here and I can afford to bless everyone. Thank you very much. Bye. Okay.
Thank you very much, madam. Thank you. Your blessings are what carries us through. Your teachings, yes. So this is again another milestone. So I would say this talk where madam came and blessed everyone, that I will say this is another milestone reached.
Thank you, ma'am. You have shown that how even if the goalposts keep changing, you can make those also into milestones. So when people are disheartened that they're not able to take a particular path, many times people give up or feel that everything is going against them. But you are the living example that even when your path keeps getting changed, you can still land in a good place and make a new milestone. Uh, Farooq, Baba, you have your camera on. Do you want to say something, sir?
Hello,
Yes, sir.
good evening everyone. Vanakkam. It was as usual a wonderful talk from GK sir. Very wonderful. All the milestones touched, and he has duly paid obedience to his gurus also. So, apart from these milestones, good surgeon, everything skilled person. What I think is very important is the good person, and all will agree with me that GK is a very good person, down to earth. Always, what we can say, he is on the earth with the junior or the senior, and he is very approachable. Very important is that the person, he may be at a very high stature than you, he may be but he should be approachable. If you have any difficulty, if you have to suggest something, if you have to seek the advice, so I think he is the right guru for this generation, and he is well versed with all the things. Maybe the what is the online system is there, videos are there, and we never miss sir in any conference. So this is a big thing, and sir is no doubt a very good orator. So thank you all. It was really wonderful, really wonderful. I thoroughly enjoyed it till the end. Really, it was really a matlab, what you can say, there were a lot of mantras in whole of the talk, which we all have to adopt in a one way or the other. Really impressive. And sir has all the gurus here also. So my pranam to them also, them all. And as the madam was saying that it is very great that she blessed us all. It is a very good thing. Sridhar sir is here, and many stalwarts of the plastic surgery is here. Thank you all.
Thank you, Dr. Farooq. Dr. Azim, you have typed out a message. Would you like to say something? And after that, Ravi Shankar, if you are ready to go, we'll come to you. Dr. Azim, are you still there?
Hi, ma'am.
Hi.
Hi, it's wonderful, really. I really enjoyed the talk, and sir was very, very transparent. The most important thing is when people grow big, they try to hide their defects. He was particular to highlight them and ensure that the juniors learn what they should know. The ethics part is the most important thing, which is undervalued now, and Sir has highlighted that. So it was a wonderful talk. We should listen to it again and again. We should play it to all the postgraduates as the inaugural video they have to watch upon joining a post graduation course, and follow it. It's excellent. Hats off to you, sir. Thank you for the opportunity.
Thank you, Dr. Azim. Though it was about supposedly about the milestones of a surgeon, like you said, it's completely valid for any, not just any doctor, perhaps any human being in any endeavor in their life. So, uh,
Definitely, every doctor.
so
Every doctor.
thank you. And
Excellent.
Budi, are you ready to go, Ravi Shankar?
Sure. I'd already put what I thought. First of all, thank you, Dr. Karthikeyan, for a very, very eloquent and heartfelt talk. It was very useful, especially the last 7 milestones that you put out there. All I wanted to say is that the mile markers that you talked about, they're just mile markers, just a mere guide to where you go. So I think most youngsters should realize that they should, just like Dr. Nirmala said, if the goalpost is changed or if there is if there's traffic on the road, you have to reroute yourself and get to where you need to go and enjoy the scenery, enjoy the journey. nothing is a waste because every experience in life ultimately comes out in your actions, personal, professional, anywhere, everywhere. And those milestones, like everybody else has said, they're not just for making a great surgeon, they're probably for making a great doctor and a very decent human being as well. So thank you so much. And hopefully we've inspired the youngsters to sort of understand that and, and follow in such footsteps like all of you, such wonderful role models. Thank you.
I'll like to Bharti, I'd like to put you into a little bit of a spot now with digital presence and social media and all. Every anything and everything is projected as a milestone, as some a big deal. Do you think the current generation loses out on the journey, like Ravi Shankar said, between the so-called milestones? What happens in between? Are people missing out on that, you think, Bharati?
Yes, ma'am. I think the social media right now, it is like the reputation in social media right now is very important. But I think it's also important that we share. I mean, we follow the ethical rules as well as share patient-related knowledge instead of trying to look for followers or try to do unethical stuff. It is important to share knowledge and have a good ethical practice. I think GK sir is one of the examples where he consistently posts only patient-related videos which are educative, and also posting this consistently will help. I don't think we should be carried away by the followers or any such milestones.
Yeah,
So,
can I add on to that, Bharati?
Yes, sir.
Yeah, so as somebody just asked me a few years back, sir, what is your aim? Do you want to achieve 10,000 subscribers at that time, a few years back? I said, no. My aim is to make a video this Sunday.
Yes.
So that is what it's like, the carrot at the end of the stick, na?
Yes.
You want to release a video, that's all. What happens on the side, the subscribers you get, the followers you get, all that is going to be a byproduct.
Yes.
So our aim is to spread whatever little I am able to glean. I try to share it. And about the question about the youngsters' use of the social media, I sincerely feel that as a teacher, I try to understand what is it that the young guys want, young guys like you want. So I try to understand. I found out that your generation is much more intelligent than us, and you are able to grasp information quicker than us. But the problem is, since you are grasping information quickly, you have a lot of time, because we had to spend about a few hours. For instance, learning microsurgery, it took me about 3 to 4 years to even start suturing. You guys are able to do it quicker. So when you do it quicker, now you have got time. And when they post on social media, for instance on Insta or something, it is just them. It's an outlet for them. They're not trying to get garner, as Bharti was saying, garner followers or something, but it is their way of expressing themselves. It's different, that's all. We cannot expect the younger generation to behave like the older generation. Then what is the big difference between two generations? They are different. They are more intelligent, they are more different, and the attitude that they have is, it has to be molded by seniors. They've got wonderful, because of their intelligence, they tend to have this is what big deal about this. I can learn this from anywhere. That sort of thing is there. But the youngsters need to realize that however much you learn from the YouTube or something else, other sources, learning from a live person, there's nothing to replace it. So that's what I wanted to say.
Yes. Thank you.
Thank you, sir. We are back to you, Dr. Sridhar. I think we've heard a bit from everybody. Your mic is off, sir. Yes, sir, your mic is off.
Sir, you are muted.
Yeah, I think now it's unmuted.
Sir, yes,
Right?
sir. Yes,
Yeah. See, I would like to tell only one thing now. What I learned as an MCH postgraduate student, I don't do anything other than skin graft. Maybe once in a while a groin flap. In other words, we all know that every single specialty is evolving. And in the beginning, the time to evolve was about 5 years, 10 years. Now every year it is evolving. In other words, the development is something which is faster because there are ways of learning is different and the research is different, and therefore technology also develops along with us. Therefore, you have to keep pace with it. Our duty to our patient is he must get the best treatment which is available today. That is important. There's no point in me telling I'm treating him what I learned as a postgraduate student. See, that's what my chief did. That's what I will do. That is right. This is the guru concept which should go. It is a tunnel concept, tunnel tubular vision that should go. I think we have to keep track of the developments much faster, and we have to do it for our patient the best what is available today. So therefore my thing is the milestones are now becoming meter stones. As far as your learning goes, it is no more miles because it is every day it changes. You have to keep pace with it. The technology you have to go along with it and then do it. Otherwise, you are lost, your specialty is lost, your patient is losing. So all these things I feel that you have to enjoy learning and enjoy doing it, and you have to give the patient the best available today. I think that is the first thing I will tell. Each one of us have to have a milestone even before you are retiring. I feel that I also have to learn to keep up. And so far I have been able to do it, but I think I don't know. Otherwise, the day you stop learning, you stop. No point in you practicing. So where you have to stop also, you have to decide that is a milestone. The day you stop walking, you must stop your practice. Otherwise, you have to keep walking on progress. The day you are not able to catch up with the progress, you stop. That's number one. I feel that that's what I feel that I am doing. In a way, wherever I can't do progress, then there is no point in continuing with it. That's one thing I think that is the last milestone must be you must satisfy yourself. You must be happy to have what you have done. That is what is the ultimate summit you have to reach is you must have the fulfillment that you have done something to the society. Unless and until what we do does not go to the society, it means nothing. It is zero. If we only earn by doing things, it's nothing. Everything has got to be replicated to the benefit of the society in which you live. If you cannot do that, then there is no point in practice. That's the message I would like to give. You must be happy that you have done, and you must do it for the society. If you cannot do it for the society, you have reached the wall. There is no more progress. With that, I would like to conclude my message.
Thank you, sir. Dr. Karthikeyan, would you like to respond to that?
Yeah. Now, we've had a lot of discussions with Dr. Sridhar sir. It's very interesting because he keeps picking your brains. He'll bring his ideas forward and he makes us think. He makes us work. He makes us innovate. And that is what is most important, continuing to learn. As Dr. Nirmala Subramaniam has put us in the chat box also, learning must be continuous. Absolutely. You have to keep continuing. I remember used to say, To rest is to rust. I don't know, I still remember those words that she said. It stuck. Yes, if you're going to rest, as Dr. Sridhar said, when you stop learning, you just stop. That's all. He just said, that was a very wonderful statement, you know. When you stop learning, you stop. If you know, you know. That's it. That's how it is. Amazing. These people, they continue to inspire. And the thing is, I do not know how many of the people here, and a lot of youngsters must be there. How many of them? I spoke about good surgeons and great surgeons. I'm sure all of you want to be great surgeons. You have got great surgeons here. Dr. Sridhar is here. Dr. Nirmala Subramanian is here. All of them are great surgeons. Talk to them. I'm sure they'll be happy to talk to you. This is what we want. The youngsters, when the youngsters talk to the seniors get motivated. The youngsters become even more motivated. It's a mutual, no? We charge each other. And that is what, when we have got such stalwarts here, it is important that we recognize these stalwarts and use their, because they want to share their knowledge. Not many people used to do that earlier. Nowadays, they are so willing. Madam, as I told you, wants to start her YouTube. She has started her YouTube channel and she is uploading videos. I just had to show her how it is done and she has started on her own. That is what you continue to keep learning. Thank you very much for this opportunity, Dr. Vidya and Dr. Patta, sir.
Thank you. Dr. Puneet, if you're still on the call, would you like to add something about importance of milestones and what
No,
actually is a
no,
milestone
not
in
nothing.
your
Not, nothing. I think it's been a fantastic. I've saved your link because I think every new entrant, as somebody said, should listen to this talk before that. And I think it's so important. What Ravi also said, to enjoy the journey, because I think in looking at those, I'm a bird photographer, as some of you know, and when I'm clicking, I'm actually not enjoying. So after about 5 minutes of taking the best shots, I actually put down my camera and put up my binocs and actually enjoy it. So I think the passion, the thing which comes through from his talk, I think the kids can only enjoy that once they understand the last two slides, which are absolutely stunning. Lovely. I mean, it's one of those milestone talks, I think, which is for marvelous medicine, which where almost every talk is a milestone. I think it's a lovely one. Thank you, Vidya.
Kalyani, you have your camera on. Would you like to say something?
Yeah, this was a wonderful talk. Thank you. I joined the beginning part of it. Dr. Karthikeyan was really great. And yeah, you won't get much from just looking at the slides, but his, like the passion like he put in, his whole life experience that he put in is great. I took some screenshots. I hope it's okay if I shared with somebody else with those screenshots. And yeah, I like this, professional milestone, fraternity milestone, and silent milestone. So these are the new terms for me. So this is wonderful. Again, thank you very much, Vidya, for this talk, for organizing this.
Kalyani, I'm sure Dr. Karthikeyan will be fine to even send you his slide deck, isn't it, Dr. Karthikeyan?
Yes.
He's the one for sharing, so I
Oh,
can
okay.
I can email them to you once he's sent it to me. No problem.
Okay.
Yeah.
Thank you. Wonderful.
If anyone else would like to, Padma, you've been busy typing a lot of messages. Would you like to say something? And what about Anjali? Would you like to add something? You have a few minutes.
Yes, sorry, madam. I could able to join in the last part of the webinar, but still, whatever I have listened in the last part, it is always a learning session at every phase of our practice. We do not know whether we are really senior or we are in the middle zone, but whatever the discussion that medical science is such a thing that you are a student and you have to be student throughout your life, and whoever feels that they are junior to us, we should guide them with a torch. Thank you very much for organizing. I would definitely need to see the slides. if I could get the mail of Karthikeyan sir and recording also, madam, if it is possible. Thank you so much.
Yeah,
May I,
nowadays we are
ma'am?
trying to send
May
you
I?
the recordings almost immediately. So I'm sure within a day or two, Dr. Radhakrishna and his tech person would have uploaded the video, and we'll share the link. Not to worry. Padma, your camera is on. Did you want to say something? You're muted, Padma. You need to unmute yourself.
I thank the surgeons who have given the cream of the knowledge for universal sharing. And it was nice to listen to innovative surgeons like Nirmala who has started those transplants in India, and to hear them personally. And his slides about, of course, were very good. It was a cream of knowledge which is gathered for us, and it should be disseminated to our youngsters. As somebody said, let them have this knowledge in the initial years itself, because we are hearing it nearly at the middle or the end of the year, but they should hear it here early. That's it.
Thanks,
Thank you.
thanks, Padma. Dr. Umar, Farooq, are
Yeah,
you trying to say something?
yeah, ma'am. Thank you, ma'am. I just want to react to Sridhar sir's last comments. As they were as usually innovative, it reminded me of the days of the COVID when there used to be all. It started online from that mostly, na? There was one lecture of sir on kinetics of hand movements and hand and wrist movements. So sir was showing those modes. Sir makes a very good videos and all these wonderful. But I had some doubt. I am telling you this because just like sir, they give you a little bit of feast to your mind. So while doing my, I examined some patients also in the hospital, and so I told sir, I don't agree with the one or two points. I messaged sir with the humility. I told sir, this is my humble thing, and Sridhar sir totally agreed. He said, yes, I also think so. Let us do some work on it in 2020. Then the way Sridhar sir arranged everything, he used to send me the how we'll arrange, where we should keep the camera, how what should in the movements. We started all that. And finally, what was done by the ISH, there was a normative data studies we did. And that study which we did on the hand movements, hand angles and movements, that was the brainchild of K. Sridhar sir. So I'm saying this because this was almost, I can say it was a milestone. We started with one lecture and sir was so welcoming the comment. It was, in my sense, it was a negative comment. But he was so welcoming it that we started the study on that. And he started the study in his patients, in his department. Then we continued the study in 5 or 6 centers in India. And it is also published now. So these are the things that a great teacher. This is the difference. So I think they are not the good teachers here in this panel here. They are really the great teachers who give a, you can say, the feast to your mind to work more, to research more, to dig more into the complications and intricacies of all these our subject basically. Thank you all.
Thank you. Dr. Ravichandran Purushothaman, you had your camera on briefly. Would you like to say something, sir?
Yeah, what I thought, just 3 years of plastic surgery training is not sufficient, particularly for a person who doesn't continue to be in a teaching institution or a very big hospital. We should insist on all the people who have just passed out 3 years of plastic surgery to go to some training centers, like good training centers, stay for 2 or 3 more years, and then start their private practice. More so for a person like me who is doing it in Tirupur. I won't call it as a peripheral center. I'll call it a semi-urban areas. That is what I'll suggest. Now, all the people who have spoken, my teacher, Dr. Sridhar, Professor Nirmala Subramaniam, all of them have been very fortunate to be in teaching centers. And that is what I want to insist. That is something which I lacked initially. And then I had to go repeatedly every 6 months or 1 year to places like Ganga Hospital, to NIMS, Dr. Bugant Reddy. And that's the places where I was able to gather up some more. And that is what I'll just think it is also necessary for a young plastic surgeon who want to venture out in a peripheral center to get some more training, because the initial 3 years of training alone is not enough. It is enough to get you a degree to learn something, but you need some more thing to practice. I like to get Dr. Sridhar's and the GK and Madam's comment on this also.
Right. We'll get to that shortly.
I fully agree.
Yes.
My professor of general surgery used to tell me, Sridhar, MS is the certificate for you to start learning surgery.
Yes.
So it is a license for you to learn. Until you are MS, you don't have even a license to learn. Now you got your MS, it is license. I agree with him that MCH is a license for you to learn plastic surgery. Therefore, you got to focus on. See, there are difference between knowledge, skill, learning, wisdom. All four are different, even though you may be looking similar. To you get skill development, you have to go to some centers. Learning, you can see in videos or by reading. Knowledge, if you are able to recall what you have studied. And wisdom comes only when knowledge with experience comes. For that, you need to go for a center. There's no question. And I was going every 3 years initially, those days. 80, I passed 85, 89, 92. Every 3 years, I was going abroad to a center to learn. People used to ask me, what happens to your practice? I said, I go for 3 months. Nothing is going to happen in that 3 months. When I come back, I will get my practice back. And I was able to do that. I fully agree with you, Ravi, that you have got to, not you now you're a senior guy. Anybody who got to go to a specific center to learn specific techniques. And plastic surgery is something which I always say, it is not reconstructing defect in the tissue. It is reconstructing the defect in the life of the patient. It is reconstructing the defect in the institution in which you are there. For example, when I started my practice in one particular hospital, Apollo, the urologists were not doing hypospadias. So I filled in that void. I started doing hypospadias. If they are not doing maxillofacial, you have to do maxillofacial. If you are not trained in that, you have to go get training done so that your patient in that institution gets the treatment done. So plastic surgery, you got to fill the defect in the institution also, not only in the tissues. So wherever that particular subspecialization is not there, you have to fill that void. To do that, you have to equip yourself. To equip yourself, you have to got to visit the other centers of excellence. That has got to go. And that is a continuous process again.
Yes.
As he said now, robotic, I just want to go. There is a place in robotic for somebody is doing in plastic surgery, which I would like to visit. My own assistant is now doing it. My associate, I would like to call him assistant. My own associate is started doing now. So he told me, come sir, next, I will show you how to do it. So I'm going next week to see him do. So I think this is a process which continues. You have to.
Thank you, sir.
Thank you, sir. Dr. Girijadar Sharma, sir, if you're on the call, we'd like to hear from you. Right. So, if anyone has any questions or comments, please type them in the chat box or lift your and put up your electronic hand or turn your camera on. Meanwhile, we'll be going to Radhakrishna.
Wonderful talk as expected, and I mean it's a privilege that I'm in front of great surgeons, Dr. Sridhar, Dr.Karthikeyan, Dr.Nirmala, whom I have had a chance to watch and associate. Dr. Nirmala was the Assistant Professor Dr. Venkatasamin is doing general surgery. I had a posting in hand surgery, and I know Dr. Sridhar from those years. I think it's almost 35, 40 years now. And I am a great fan of his. Not just as a surgeon, as a person, as an administrator, as a mentor, and so many things. And interestingly,
இன்னொரு few minutes வந்துடுறேன்.
and the interesting thing is I got to know Dr. Karthikeyan accidentally and how it happened. But during the COVID, when I was doing the lectures on learning general surgery, I met him on that, and then he was a regular in during the COVID time on the LGS Zoom, and I think he was doing every day, excepting maybe one day, and his lectures had the maximum audience.
Yes.
As Dr. Farooq was saying, that I wondered that, see, he's made. I could understand the hand surgery, plastic surgery so well, although I'm nowhere near. I mean, I think it's the way he gave orange juice to people. He didn't give oranges. I mean, that's why everybody came in. And then recently asked him, sir, so many videos, and who helps you? Which is a technical team? He said, myself. I myself do everything. I mean, that surprised me because, doing things, especially videography and editing, and it's not that easy. It's a lot more difficult than operating on a hand. I understand, and that passion is something which is really touching. Now, but I have a couple of points to make. One is not everybody will get a chance, or everybody will go through the path what Dr. Karthikeyan has gone, because you need to either somebody should tell you that this is your milestone, go to the next milestone, and so on and so forth, and they should have the ability, and they should have a possibility of going to the next result. Because first of all, if you ask me now, have you reached your milestone, what you reach at this stage, I don't know, frankly. How to I'll ask the Karthikeyan this. I have some more questions, but the first question is, how will I know whether I have my milestones are proper, that I've or I'm behind, or I may have delayed milestones? How will you decide that in any specialty for the matter? You have to unmute.
Yeah, that's a very interesting thing. How do I know whether I am on the correct path? How do I know that I am making progress? The thing is, see, you were saying that Karthikeyan had this opportunity to work in these places. Yes, Dr. Sridhar was saying, I decided, I have planned all this. Nothing was planned. Nothing was planned. My entry into Kilpauk Medical College was an accident. That was not one of my choices for plastic surgery. My choice was Madras Medical College, Stanley Medical College, and Madurai Medical College. There were three options, but I got it in the waiting list. That was the best thing that happened to me. And getting into Stanley Hospital was something which was not my choice. The director of medical education at that time happened to be my previous general surgery professor from Madurai, Dr. J. Rajappa. He posted me in Stanley. I did not know that I would be posted in Stanley. So I believe that when I have just typed that message, when the student is ready, the teacher will appear.
Yes.
It always happens. It always happens. When you are ready, it clicks. I don't know. This is a scientific forum, and I cannot keep talking about religion and philosophy. But that is life. It takes you. And Dr. Nirmala Subramaniam was talking about how she was shifted from one place to another and how she made the best use of it. Ultimately, I think as you keep doing, you just keep doing what you want to do, keep doing. And when another thing I like to say is, when your intention is good and you're willing to work towards that intention, the entire universe will make it happen. I firmly believe in that. So if I am a young surgeon now, I've just come out of the medical school and I've started my practice in surgery. I keep doing what is good. It will take me somewhere. When I'm ready to learn something, I will find. Nowadays, we have got a lot of opportunity to look for. You can just send an email to someone and say, I would like to work with you, and immediately you can go there. So there are so many opportunities. I think ultimately your heart will tell you whether you're on the right path or not.
The second thing I want to comment on is the summit. Is there anything called a summit? Because summit keeps changing. I don't know whether Vidya has reached a summit. I really do not know. The thing is, why is it that if 100 plastic surgeons train, only one reach the summit? Why is that such discrepancy? Like, why is only one Sachin Tendulkar? Why
Yes.
the rest doesn't happen?
Yeah, there is one Mount Everest. It is open for everyone, but only a few are able to scale that Mount Everest. Why is it? I'm sure there are so many other people who are capable enough of scaling it, but they don't do it because they don't have that attitude. I want to do it. That attitude is what decides your altitude. So that is where it occurs. So like for instance, we had one Lata Mangeshkar. Do you think nobody else in India can sing as good as her? There are many people. So they must come out. They must come out. They must realize their potential. I can do this. I want to do this. Then they will achieve it. That's what I feel, sir.
I have an answer for that question.
Yes, sir.
Unless you travel, there is no question of milestone. You are standing. So the question is, unless you decide that you are going to the next step, then only the milestone comes. So supposing you have been doing only open laparotomy, even today, there is no question. You are standing still. So you have migrated. You have started going everywhere. Now you have reached the robotics. So you have every milestone you have done. Initially, you were doing laparotomy was a milestone. Then you have been doing laparoscopic surgery was a next milestone. Now you are doing robotic surgery is a milestone because you have been progressing. But there are still surgeons who may not be doing robotics. So they have reached Chengalpat, they have not gone beyond. There are some who are still stuck in Tambaram. So that is how it is. So unless you travel, that is exactly I said, unless you travel, there are no milestones. And milestones are usually realized after crossing when you look back that you have crossed that milestone.
But sir, does it mean that traveling means place to place? Hospital to hospital, institute to institute?
Your progress.
Progress. What he means is different.
This is surgical milestone. As we said initially, yes, unless you progress, you will never.
Now,
Thing about summit, about me reaching summit, it just means that I'm on my way down. Of course, like Puneet said, till I find another mountain to climb, I can say that.
you reach the summit, you
Yeah.
remain there. You don't roll down unless the
Stay
summit
down. Once
pushes
you
you
reach
down.
the top, there's only one way down.
The thing
You have reached a milestone. Now you have gone into the web now. So that's a milestone you have reached.
Dr. Karthikeyan, now, first of all, becoming a teacher, teaching every day, and not just teaching every day as long as you have offline students, online teaching, and then becoming an influencer, and try to make videos and stuff so that the teaching will remain forever for generations to come. I mean, what may you read some philosophy, or you have a guru who tells you do all these, or what is that? What your mind thinks differently from the rest?
I don't know. I thought I was quite a normal person. You're making me sound like some abnormal creature from Mars or something. See, the thing is, somebody asked me this question earlier. What makes you make the videos? So I said, see, when I learn something new, I get very excited because basically my skull is a little thick. Knowledge doesn't go in very easily. I have to make an effort to bring the knowledge inside. But once the knowledge gets in, I get very excited. Oh my God, I've understood this. I'm actually able to relate with the Archimedes who shouted Eureka on the roads. Hopefully I won't be doing that. But still, when this knowledge goes, I feel that I'm so happy that I want to tell everyone. I want to tell the world. Because when I was studying, I found some aspects difficult. So then I realized when I'm reading now, maybe there is somebody like me out there who's struggling. Let me help him. Let me help him or her. So I try to make my videos as simple as possible because I basically am not very savvy, tech savvy. So what I say is, if I can understand it, that person can understand it. So my standard of teaching, some people have even complained to me, why do you speak like you're talking to an LKG child? I said, no, that is how I'm talking to myself. Actually, when I make the video, when I think of it, I'm trying to teach myself. I'm teaching myself what is happening there. So the things are, I'm trying to make it simple because I feel that only when things, because these guys, these youngsters can understand quickly. And when you, for instance, when I was studying brachial plexus, about 10 years after I finished my MCH, I could understand what is the anatomy of brachial plexus. Today, the postgraduate, second year postgraduate will be able to tell you what is the plan for this patient with brachial plexus injury. And amazing, they are absolutely intelligent. So we have to keep, we have always been adapting, sir. We used to first draw on the blackboard, then we used to write on the whiteboard. And so I used to give this example of Saravana Bhavan and Geeta Ratna Cafe. Ratna Cafe had as good idli sambar as Saravana Bhavan. But Saravana Bhavan has got about 200 franchisees all over the world. Ratna Cafe is nowhere. That is because they adapted. We need to adapt. So this YouTube teaching or teaching on the social media is some way of adaptation. That's all, sir. There's nothing more to it.
Now, when you're talking about the younger generation, now whenever I talk to any individual, like a doctor or a nurse or a technician, and when I ask them, what do you think of the younger generation? Invariably, all of them have the same answer. They're not as good as the previous generation. Something is seriously wrong. Everyone says that they're not that sincere, they're not that honest. Now, are the milestones changed, or don't you think the younger generation want the milestones to be quicker and reach the summit quicker?
No, that's what I said. Our yardstick of measuring the younger generation is old fashioned. We are measuring the younger generation with come and give respect, say good morning to your seniors. That we have learned. That is our yardstick. You can't use that yardstick to measure a youngster. Youngster is not like that. He'll keep his hands in his pocket and say hi. He'll say hi to you. He may be a youngster, you may be as senior as old as his father. He'll say hi. Because it is not wrong for him. For his generation, that is how evolution is occurring, sir. We have to understand that. They are not bad, they are wonderful, but we need to guide them in the correct way to channelize their energy. That's the only thing I feel.
And they are, sorry to interrupt, they are very much goal oriented, which at all times we were not. In
No,
their curriculum also, while they are doing that, they are very goal oriented more than us.
Yes.
no, as
And they have a lot of opportunities in front of them. That is true also.
no,
And I think they are the better learners than, I think, at least me. They are better learners. They grasp the things very quickly. This is my observation.
I was talking to Dr. Adarsh Chaudhary, one GA surgeon, just a few days ago, and he was saying that, younger generation are technique oriented, they're not value oriented. Those milestones are different, these milestones are different. They have to go hand in hand. They want to learn technique and so on, so forth. Now, one interesting thing he was saying, when he got into the early part of surgery, he wanted that he should be able to complete the operation, patient go home. Now, whenever he thinks he is operating, he'll think, but the patient 10 years from now will be, is this useful for the patient to be a normal person or live longer and so on. So Dr. Karthikeyan kept on saying on that point again and again that the long thinking, and that's where value orientation comes, and that's where there is some issue because everybody wants to learn a certain technique and go on. My final point is, our age and milestones go hand in hand. You can only reach the summit only when you're old.
Yes, for our generation, that's what I said. Our yardstick is different. So if you would, I'm sure you must have had mentors in your specialty also. And they were all old when we started respecting them and all that. Now, you have got the same respect almost, isn't it? Or more.
Well,
and
almost.
You are younger than them.
Yeah.
You are younger than them. So that age of attaining the summit is becoming lesser and lesser. That is because you are more intelligent and more skillful than your older generation. So now your next generation will be the same. They'll achieve it much earlier. They will achieve it. So that is why I'm saying the summit age, it is not related to age. Achieving the summit is something that the timeline is different for people. One person may achieve it at 40 years of age. One person may achieve it at 70 years of age. It doesn't matter. For them, achieving that summit is the goal. It doesn't matter at what age they achieve it.
Well, wonderfully said, sir. Great evening indeed, and I'm really, really inspired by your talk. Thank you so much. Vidya.
Once again, thank you, Dr. Karthikeyan, for sharing all those pearls of wisdom and being a proponent, or you're on the side of the youngsters, and I'm sure the ones who listen to your talk later on YouTube will be very happy about that. Your closing comments, Dr. Sridhar. We are almost out of time.
Thank you.
Thank you so much. Thank you, everybody. Good night.
Good night.
Thank you. Thank you very much. Bye. Good night.
Bye. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night. Thank you, everyone.